Thickened, yellow, crusty nails, toenail fungus. Why do we get it and how do you treat it? That's what I'm going to cover today on the video. I'm a board certified dermatologist, and this is a problem that I see all the time in the clinic, and so many people have it. It may cause embarrassment. You may not want to wear sandals out in the summer because you're afraid that somebody's going to judge you for how your nails look. So we're going to dive into this topic and talk about the causes and the treatments, both those that you can do at home and the ones that we might consider if we're treating you in the clinic. First off, why do we get toenail fungus? Well, first, fungus is everywhere in the environment. Molds and fungus are some of the most prolific organisms, and it's easy to pick it up if you're walking barefoot anywhere, and some people with your particular immune system are just going to be more prone to it. These organisms like to grow in the little bit cooler environment down underneath the nails. It's further away from the heart. The immune system is not as active there, so it creates a perfect environment for them to start to grow as they feed off that dead keratin under the nail bed. Trichophyton rubrum is the most common organisms that we'll find in a nail clipping if we do test somebody, and it's not the purpose of this video to go through every single organism that we could have because the treatments are largely going to be the same. But in general, the classes of organisms are dermatophytes, that's what Trichophyton rubrum is, and then we have yeast. Yeast is another organism that can grow under the nail, and the appearance may be slightly different, but some of the treatments are still going to be effective. And then we have something called non-dermatophyte molds. We're not going to go through all of those. We're going to focus on the treatments today. Now, as I said, not everybody needs to treat their toenail fungus. If it doesn't bother you and it's not causing pain and you're not self-conscious about it, you can live with this condition in many cases. But if you have diabetes or you have a really compromised immune system, it might be a good idea to treat the toenail fungus because it could compromise the skin barrier and put you at risk for more significant infections. And some of these yeasts and non-dermatophyte molds, if they get inside the body, they can also be a pretty big risk in and of themselves. At the end of the video, I'm going to touch on some of the home remedies that you can pursue to treat this, and we're going to start with the prescription topical therapies. So topical therapies are things that are applied to the exterior portion of the nail, and there are a few options. The first is called cyclopirox. The brand name is Penlac. The data on this are really bad, guys. I'm telling you, I've seen people use this forever, and it just is not highly effective. And there's more and more resistance to this particular medication. And when you're treating a nail topically, you have to put the medicine on the top of the nail, using my hands to illustrate, because I don't want to show you my feet. Not for free. We're going to put the medicine underneath the edge of the nail and paint it on top of the nail, and we're getting some of that penetration and some from the underside to help kill that fungus. Now, the reality is, if the nail is thickened and it is discolored, it will take 18 months, give or take, to fully grow out and become healthy again if you're properly treating the nail. So you have to be committed to use these topical therapies for a period of a year to 2. So if cyclopirox is not my favorite treatment, here's a couple other options. One is called Jublia or efinaconazole. Now, this one came out a few years ago and it had much better data than cyclopirox, but the data is still not super fantastic. We're looking at between 30 to 40% of people get clearance of the fungus under the nail. And this is when you're using it daily for months and months and months. So if you start skipping days, you forget to use it for a week or 2, it's going to take longer for it to clear. And another medication that came out, and I think might have even been pulled from the market now, is called Keratin. This is a completely different mechanism of action, and I don't even know the last time I wrote this one. I haven't seen it in pharmacies for a few years now. Now, medicines like Jublia or efinaconazole, they tend to be pretty expensive. Most insurance companies look at this as a cosmetic treatment. They don't want to pay for some of these topical therapies. So oftentimes what I'll do is I'll work with a compounding pharmacy and create a 10% terbinafine solution. Lamisil is the brand name of terbinafine, and this one you get a bigger size for a lot less money when we compare it to things like Jublia or efinaconazole. That name, efinaconazole. I don't know who names these things. But this 10% terbinafine solution does tend to work pretty well, but you do have to be committed to use it consistently, just like we said. When I give it to patients, I tell them you're gonna paint this on the nail, drip it under the edge every single night for a year. Some patients find that too daunting and they'll say, I'll just live with it. It doesn't bother me that much. And other patients will go for it and will eventually see improvement in the nail. Now, once we've looked at topical options, now we'll start to get into oral medications. And these are going to go inside the body and come out through the sweat, come out through the skin, and they can start to kill the fungus from the inside. Now, these are going to carry a little bit more risk because some of them can cause problems with the liver, particularly if you're on statin medications. Those are drugs that we use for cholesterol. Or if you tend to drink more alcohol or have had a history of hepatitis or cirrhosis, we have to be much more careful in using these medications. So the first of those is called fluconazole. It's one of the most common antifungal medications that we use. It's commonly prescribed to women who might have a yeast infection, and it can clear that up pretty darn quick. But we also can use this to help treat toenail fungus. But the course is still long. People can be taking these medications for months at a time, and that is just because it takes the nail a long time to grow out and be healthy. A cousin of fluconazole is called itraconazole, and this is a little bit, considered more potent of a medication. There's less resistance to itraconazole than there is to fluconazole, and so sometimes we will go to that, but it does carry a little bit more risk of liver problems, but it's something you have to discuss with your doctor to determine your individual risk. But I just want you to be aware that it is an option. If I have a patient that's taking a statin medication, a cholesterol medication, then we're more likely going to use something called terbinafine. And I usually use terbinafine just because of a little bit lower risk of interactions with many different types of medications. And we have patients take this pill. Now, the traditional way is it will test somebody's liver enzymes and put them on this pill for a period of 6 to 9 months. And then during that time, do monthly liver checks just to make sure that we're not messing anything up. But there were some papers that came out a few years ago, and what they showed is something called pulse dose therapy. So instead of having patients take terbinafine every single day, I have them take it for 7 days during the month and take the rest of the time off. The medicine starts to build up under the nail, and we get clearance that is almost as good as taking it every single day, but it's a lot less risk to the liver. Some people get really freaked out over terbinafine and using that because of the risk to the liver, but the reality is how many people are taking Tylenol every day, and it's probably just about as bad for your liver. And we don't have second thoughts about doing that. So when we talk patients through this and we find that it's a good option, we do pulse dose therapy, so 7 days of pills every single month, take the rest of the month off, and start over on the new month with 7 more days of therapy. Now, the clearance rates for itraconazole, fluconazole, or terbinafine, when we take them orally, are going to be much higher than using the topical medications. And for some patients who are particularly motivated to get rid of the toenail fungus, we'll have them use both an oral medication and a topical medication in order to get clearance of that toenail fungus. The more things that we do, generally we're going to see better results, and it keeps patients in the habit of doing something daily. Now, if you've had toenail fungus and you've shopped around for cures, you might have come across laser therapy, and there are certain lasers that can help to kill the fungus, but these are generally going to be a cash pay option. Again, insurance companies generally are not going to pay to treat toenail fungus with a laser. Unfortunately, it's just the way that it is. These lasers go in and create heat around the fungus to help kill them. And another method that I use in the clinic is we'll use something called a CO2 laser, which is not specifically geared to kill the fungus, but we use it to drill holes in the top of the nail so that when somebody paints on the topical antifungal medication, it actually can penetrate down through the nail more efficiently, and it does help us to clear those nails up a little faster. If the nail has become so thick that we're just not going to get any results from a topical medication, or we even doubt that we're going to get improvement from an oral medication, kind of the last ditch resort is to do a toenail removal. So in this case, we would numb the patient's toe up and we'll physically remove the nail, and then while the new nail grows in, they're going to go ahead and use topical antifungal medications, sometimes oral antifungal medications as well, so that as the new nail grows in, it's much healthier and hopefully looks much better. Now, the best thing that you can do is to not get toenail fungus in the first place, and this is where proper hygiene comes in. If you're using public showers, it's a great idea to wear sandals in the shower. Just make sure that they're ones that you're not going to slip and slide all over on and risk a fall. That's a bad thing. Clean your feet while in the shower, and just avoid walking barefoot, especially in public places. This is where you're more likely to pick it up. If you're diabetic, you are at a higher risk of getting toenail fungus, so the better control you have over your diet and exercise to avoid diabetes, reverse diabetes or to reverse pre-diabetes, you're going to have a less likely chance of getting toenail fungus. Now, what can you do at home if you have toenail fungus? Now, the options again are still kind of limited here, but there's some anecdotal evidence that using things like tea tree oil, make sure that it's diluted. You don't want to put straight 100% tea tree oil on there. It's going to cause some irritation. But tea tree oil has some antifungal properties and over time may help to clear toenail fungus if it's not particularly bad. If your nail is a ½ inch thick, I wouldn't rely on tea tree oil to get rid of it. Vicks Vapor Rub with that camphor and menthol is another one that may have some antifungal properties, and you can rub that on the nail at night, put socks on before you go to bed. It's a good idea to have breathable footwear, and again, keep your feet clean. Hopefully some of these tips and tricks and understanding the medication options to treat toenail fungus have been informative for you, and if it's something that you struggle with, you kind of have an idea of what you might ask for when you go to the doctor. And I think it's also important to understand that you don't always have to take the pill every day. That's worth a conversation with your doctor because sometimes that pulse therapy might be a better option for you depending on your individual risk factors with your liver and things like alcohol consumption or other medications that you take. I thought this was a timely topic because it's summertime and so many people are having, they want to wear sandals and they're dealing with toenail fungus. But what other kinds of topics would you guys like to see on the channel? Let me know down in the comments and I'll cover more common conditions that happen on the skin, hair, and nails. And I'll see you guys back on the next video.